Seema Verma, now the administrator of the Centers for Medicare and Medicaid Services, guided her home state of Indiana in expanding Medicaid eligibility under the governor at the time, Mike Pence, while emphasizing personal responsibility. Stephen Crowley, The New York Times, Washington. The Trump administration announced on Tuesday what it called a new day for Medicaid, telling state health officials that the federal government would be more receptive to work requirements and other conservative policy ideas to reshape the main government health program for low-income people. Seema Verma, the administrator of the Centers for Medicare and Medicaid Services, said the administration would approve proposals from states to require work or community engagement for people who want to receive Medicaid. The Obama administration had turned down such proposals, saying they would not further the purposes of Medicaid, which are to promote health coverage and access to care. But in a half-hour speech to the National Association of Medicaid Directors, which represents state officials, Ms. Verma said on Tuesday that Medicaid had a higher purpose to help people rise out of poverty and government dependence. Many people on Medicaid, including many who became eligible as a result of the Affordable Care Act, are able-bodied adults of working age, Ms. Verma said. These are individuals who are physically capable of being actively engaged in their communities, whether it be through working, volunteering, going to school or obtaining job training, Ms. Verma said. Let me be clear to everyone in this room: we will approve proposals that promote community engagement activities. She heaped criticism on the Obama administration, saying it had focused on increasing Medicaid enrollment rather than helping people move out of poverty and into jobs, believing that community engagement requirements do not support or promote the objectives of Medicaid is a tragic example of the soft bigotry of low expectations consistently espoused by the prior administration, Ms. Verma said. Those days are over. Jason A. Helgerson, the Medicaid director in New York State, said on Twitter that Ms. Verma's comments were absolutely awful. It was absurd for her to suggest that she was ushering in a new day for Medicaid by taking it away from millions of people, he said. CMS director said that providing Medicaid to poor able-bodied people without work requirements a form of soft bigotry. Absolutely awful. Pic.twitter.com/MIGOFLHOTK, Jason Helgerson at Policy Wonk 1 November 7, 2017. Ms. Verma worked for years as a consultant to state Medicaid officials. With her guidance, her home state of Indiana expanded Medicaid eligibility under the governor at the time, Mike Pence, while emphasizing personal responsibility by requiring beneficiaries to pay premiums and contribute to health savings accounts. In her remarks on Tuesday, Ms. Verma did not renew Republican calls for repealing the Affordable Care Act. But she criticized the law's expansion of Medicaid, an option that has been taken up by 31 states. The thought that a program designed for our most vulnerable citizens should be used as a vehicle to serve working-age, able-bodied adults does not make sense, Ms. Verma said. Average monthly enrollment in Medicaid, according to the Congressional Budget Office, has climbed by nearly a third, to 77 million people, since President Barack Obama signed the Affordable Care Act in 2010. The Kaiser Family Foundation reports that at least 6 states, Arkansas, Indiana, Kentucky, Maine, Utah and Wisconsin, have pending waiver requests that would require work as a condition of eligibility for some Medicaid beneficiaries. New Hampshire submitted its own proposal last week. Community engagement is a broad term that states define in various ways. It can include not only paid employment, but also volunteer activities, going to school, job training, searching for jobs, caring for elderly relatives and even treatment for drug or alcohol abuse. Donna Checkett, a former Medicaid director in Missouri, said Ms. Verma's position on requiring such activities was 180 degrees different from that of the previous administration. Cindy Mann, who was the top federal Medicaid official under Mr. Obama, said Ms. Verma's objections to Medicaid coverage of working-age, able-bodied adults were upsetting and disturbing. The Affordable Care Act gave states the flexibility and financing to cover that population in diverse ways, without seeking a federal waiver, Ms. Mann said. And she noted that the expansion of Medicaid had been defended by Republican governors including Chris Christie of New Jersey, John R. Kasich of Ohio, Rick Snyder of Michigan, Chris Sununu of New Hampshire and Brian Sandoval of Nevada. Ms. Verma also announced changes to speed the review of state requests for waivers of the federal Medicaid law. She said the Trump administration could approve some waivers for 10 years. Waivers have typically been approved for 5 years, with the possibility of an extension for 3 years. In addition, Ms. Verma said, if we approve an idea in one state and another state wants to do the same thing, we will expedite those approvals. She said the Trump administration would issue a scorecard measuring and comparing states' performance in improving the health of people on Medicaid. The federal government and the states together spend more than $550 billion a year on Medicaid, and people deserve to know if the money is producing positive results, she said. Matt DiCello, the executive director of the National Association of Medicaid Directors, said state officials agreed with Ms. Verma that they should focus on Medicaid beneficiaries and the outcomes of the care provided. But, Mr. DiCello said, we have a lot of disagreement with the contention that Medicaid should not be serving able-bodied adults of working age. State officials said that many Medicaid beneficiaries had low-wage jobs that did not provide health insurance for them or their family members. Ms. Verma insisted that the Affordable Care Act had given states perverse financial incentives, paying a higher share of Medicaid costs for newly eligible beneficiaries. The ACA, she said, moved millions of working-age, non-disabled adults into a program that was created to care for seniors in need, pregnant mothers, children and people with disabilities, stretching the safety net for some of our most fragile populations, many of whom are still on waiting lists for critical home care services, while states enroll millions of newly eligible able-bodied adults.